into it in the sense that the government has to spend money both on facilities and on insurance premium. Individuals have to spend money. The corporate sector and the organized sector should be encouraged to make joining a group health scheme compulsory. I mean, it should be part of the terms and conditions of service, which it isn't in most cases. I tell you, I mean, in the 11th plan, we emphasize the importance of health and education. And I think we've made a good start. We put it on the agenda. I don't think we've provided as much resources as are really needed, but you know, the system didn't have the capacity to absorb them. When you start something, it takes a long time. But in the 12th plan, you know, which begins in the year 2012, the system is now geared up. It's crying out for resources. So this is going to be one of the big challenges. Are we in a position to shift resources from the sorts of things we used to do and put them in health and education? I think we should. No question about it. But that's second point, it's not just the central government. Most of the money on health and education has to be from the state governments because it consists of salaries. So it's one thing for the central government to be aware of this, but we have to make this a priority at the state government level also.
You know, there are many state governments today who have introduced this micro insurance scheme more as a kind of a vote winning kind of a scheme, you know, if I may say so, you know, which are obviously being very welcomed by the people at large. But again, if you actually look at these schemes, they are not sustainable in the long term.
Well, I think that's very true. Many of the schemes have not been actuarially worked out.
Exactly.
In a lot of these things, what happens is you keep expanding the services, but you haven't worked out what it's going to cost. In fact, in the case even of the Rashtriya Swasthya Bima Yojana, we've issued a number of cards. But you know, the awareness of the guys who got the cards that there's a service they can now demand, this is going to take a little bit of time to build up. So the actual, whether the insurance system is viable will only be known when people start fully demanding the services that they're entitled to. And some state governments have schemes that are much more generous than the Rashtriya Swasthya Bima Yojana. And they are running into difficulty in the sense that the bills are mounting. So, you know, that happens in any insurance-based system, that if you don't look out for ensuring that the scheme itself is viable, you run into difficulties. But fortunately, we've only just started. So at the start of the 12th plan, we are in a position to sit back and say, look, these are the different experiments, this is what is worth supporting, and this is what we should do.
Montek Singh Ahluwalia, the Deputy Chairman of India's Planning Commission, is in the middle of formulating the next 5-year plan for India. And even as Dr. Ahluwalia is targeting a 10% growth rate for the economy, he agrees that ensuring a higher spend on healthcare will be crucial to ensure that this growth is sustainable.
I'm really pleased to hear that at least in the 12th 5-year plan, we are seriously looking at least starting to build a national health system where the government certainly wants to raise its spend from say 1% to 2 or 3%, and where the private sector can top that up and make it like close to even 10%. Now that would then create a very robust and a very sustainable model, because even today 80% of an incremental spend in healthcare is coming from the private sector, you know. And what is also really good for us is the fact that we have a very robust pharmaceutical industry, which is also allowing us to have affordable drugs to support this system.
No, I mean there are lots of strengths, but really in the 12th plan, what we've got to do is at the very minimum double as a percentage of GDP the spending that we do in the health system. You know, it's not true that we don't have resources. I mean, for example, 1% of GDP is effectively what we actually spend on subsidizing kerosene and LPG. Now, a lot of people feel that subsidizing kerosene and LPG is important for the poor. But imagine to yourself whether it would not be better not to subsidize that to that extent, because we know there's huge leakage, and put the money that is saved into health facilities for the poor. So, I mean, if we wanted to redirect our resources, the resources are there. But we cannot keep doing these things and find another 1% of GDP for health and another 2% of GDP for education. I mean, the 12th plan will have to address these issues.
Absolutely. And, you know, Montek, finally, I would say that, you know, getting the Public Health Foundation of India involved in helping us to sort of develop a good and innovative national healthcare system is also going to be a very, very good way of doing it.
Yep, I agree.
And I think all the stakeholders in the healthcare sector are very keen to see that we develop such a healthcare system, because I think everyone can benefit. It is already forecast that the healthcare sector is likely to attain a size of $300 billion by 2025. This is a huge opportunity for everyone. So I think it is a very exciting time for us, but we must ensure that we do build an inclusive healthcare model which allows everyone to benefit.
You know, the advantage, we have some advantages. I mean, one is there's a lot of low-hanging fruit. Better maternity care, earlier diagnosis of complicated cases of pregnancy, a little bit better malnutrition treatment and prevention. These things alone would make a huge difference to some of the key indicators like the maternal mortality rate, the infant mortality rate, etc. I think that should be very easy to do even within the existing system. And you know, some of the information I get is that by the time even this plan ends, when you get the latest data, you will see that the infant mortality rate and the maternal mortality rate is reducing faster than it was doing earlier because of the National Rural Health Mission and all these ASHAs and this counseling that's taking place and so on. I think immunization and vaccination, I mean, that is a low-hanging fruit. It is completely unjustifiable that only half the Indian children are getting a full dose of immunization. Very simple expansion of both public and private health services, not very high cost, but just determined with accountability, could raise this to 100%, which it should be. That alone will lead to. Then we get into the more complicated issues of treating the kind of diseases that are more chronic, diseases related to age, diseases related to lifestyle, and we have to tackle those too. But you know, like in the next 5 years, in my view, if you tackle the low-hanging fruit, you can get a huge outcome, and we should be concentrating on that.
Yeah, unfortunately, we are a country with, you know, the kind of challenge of the developed world and the developing world. You know, basically we've got, you know, we can talk about a young population, but we also have a significant aging population. So the numbers are staggering, you know. So it's a huge challenge, but I have no doubt that, you know, through a lot of brainstorming, a lot of innovative ideas can come up, and we can actually create a very, very interesting healthcare model, which, you know, the world will be very interested to emulate.
Well, I mean, the world will be watching us very closely, after India and China. Because China also, by the way, in the early stages of their reform, they ended up slightly dismantling the public health system. But in the last few years, they've brought out new health policies that seek to correct that mistake. So people will be watching India and people will be watching China. And I think we should be aware of what the Chinese are doing and try to learn from that.
Thanks, Montek. That was most interesting.
Thank you, Kiran.